I did a small research project looking at the sun protection and behaviours of doctors in hospitals, just looking at what their skin type is, what their behaviour is in the sun, whether they like to tan in the sun, if they use sunscreen, do they get sunburnt, and have they ever used sunbeds. I looked at 163 doctors in total. They were mainly based in the West Midlands, but obviously they also came from the rest of the UK to regional meetings and educational events as well. What we found was that the doctors that we participated in the survey were similar to the general public. So they also suffer from sunburns. A lot of the doctors do use sunscreen, so over 70% of the doctors use sunscreen, and the most popular, well, the one that they use the most is the factor 30, which is good, but unfortunately some of them do get sunburnt, so more than 2 in a year. It looks like female doctors seem to have more sun protective behaviours, though they also get more burnt. So that's an interesting area which probably need further exploring. It was worrying that it shows that about 1 in 10 doctors in this survey seem to have used sunbeds in the past, or have used sunbeds at the moment. So that's a worrying bit because obviously there's risk associated with skin cancer.
So we set up with a small study to look into the behaviour, but we were quite surprised of what we have found. And it's not just at the junior doctor level, we have also found at the more senior levels. Artificial sun tanning using the sunbed has been shown to increase the skin cancer risk, either non-melanoma or melanoma skin cancer. This has been well known over the last 4 or 5 years. And the fact that the doctors, especially the secondary care doctors, they are the front line of the medical treatment for the patients, giving advices, giving the treatment to the patients, exhibit the similar behavior to the public is rather worrying, because obviously the behavior and understanding about the nature of the photocarcinogenesis, it doesn't seem to be correlate in that directions. So I think there are multiple layer approach that probably comes up from this survey in terms of how we address these issues in the future, whether we need to engage the medical profession a lot more in our primary prevention program, not just aim at the public, but also aim at the secondary care and also more senior doctors in terms of the seriousness of the artificial light tanning risk associated with skin cancer, because we are all not immune, because not just because we are at the front line, but we are also patients at some point in our life if we are not careful. It's very interesting about this question, because I certainly remember when I was a medical student, dermatology teaching is minimum, mainly because we are not the most exciting specialty, and also the amount of teaching we got from actual dermatologists were quite minimum, and certainly in UK it varies from one medical school to the other. So certainly in terms of the emphasis at the level of medical students, starting from the educational level, teaching would need to be addressed. And certainly when we look at the level of knowledge in terms of the photocarcinogenesis, I think they probably will need to get more information. So in terms of public health educational program, we also need to have collateral, not just at the public level, but also in the medical school level. I think that will hopefully change in the future with more further emphasis. We actually haven't had chance to look into this, but I'm sure this has been looked at in terms of smoking behavior associated with the lung cancer risk. But as we are all aware, knowledge and behavior, they are not correlated.